everyone, my viewers and my dear students, especially third year student. I welcome you all in my surgery online class, and today topic of discussion is Cushing syndrome. Adrenal gland secretes cortisol, and the increased level of cortisol or hypersecretion of cortisol leads to the disease Cushing syndrome. Cushing syndrome is further subcategorized into exogenous and endogenous Cushing syndrome. In case of endogenous Cushing syndrome, there is presence of adrenal tumor or pituitary tumor and excess secretion of ACTH that will leads to the Cushing disease. So the reason here is Cushing disease in case of endogenous Cushing syndrome. Whereas in case of exogenous Cushing syndrome, the reason is medications, especially corticosteroids. So when the patient is taking corticosteroids in case of arthritis or after post-operative. Now let's focus the etiology of the endogenous Cushing syndrome. The hypothalamus will secrete CRH, that is corticotropin releasing hormone, and that will stimulate anterior pituitary to secrete adrenocorticotropic hormone, that is ACTH, that will send signal to the adrenal gland for the secretion of cortisol. When the cortisol will get secreted, adrenal gland will send signal back to the hypothalamus, and hypothalamus will switch off the process. So that's how the feedback mechanism goes on. But if there is formation of any tumor in the pituitary gland or adrenal, then this process won't stop and it will go on. So the adrenal gland will keep on secreting cortisol, and this hypersecretion or the increased level of cortisol will cause Cushing disease. In 70% cases, the most common reason is being Cushing disease for Cushing syndrome. Endogenous Cushing syndrome occurs 1 in 1 lakh, and women are more affected. Typically, women get 5 times more likely to be affected. Now let's study the symptoms of Cushing syndrome. First, there is destruction of immune cells. Immunity gets very poor, so recurrent infections occurs. There is weight gain and hypertension, high blood pressure, and osteoporosis, that is weakening of bones. Now why the weakening of bones occur? In case of stress, there is more secretions of cortisol, and when cortisol releases, that will cause mobilization of the calcium from the bones into the serum and blood. So the calcium will get depleted into the bones, and bones will get weak and osteoporosis occurs. Now weight gain occurs because high cortisol levels will increase the appetite under the stress condition, and then the patient will have more craving and rapid weight gain will occur. There will be stretch marks, fat depositions in the stomach, and face will look like moon face. Reason for hypertension is that the cortisol molecule much more resembles like aldosterone molecule. The hypersecretion of cortisol will stimulate more aldosterone receptors, and that will stimulate more sodium potassium pump and further will lead to the influx of more sodium into the cells. Other symptoms are buffalo hump, full moon shaped face, truncal obesity, and presence of abdominal striae. There will be muscle wasting and thin extremities that is directly related to the effects of excess cortisol on tissues. Skin will get dry and easy bruising will occur. The bones will become weak and easy prone to fractures, that is osteoporosis. There will be hyperglycemia, diabetes mellitus, hypertension, and increased risk for cardiovascular diseases, increased vulnerability to infections, and poor wound healing. There will be amenorrhea and psychiatric mental disturbances. Beside this, there will be hirsutism, that is excess of hair growth, and early baldness in females. In diagnosis, to measure free cortisol in the urine sample is collected, blood and saliva test is done, then dexamethasone suppression test is done where the low dose of dexamethasone, that is exogenous steroid, is given to suppress the ACTH production. But in case of endogenous Cushing syndrome, that will not suppress the ACTH. Further, the ACTH plasma level is checked and the imaging is done like MRI of pituitary, CT of adrenals, CT of chest, and the CT and MRI of abdomen and pelvis area is also done. Patient is not asked to stop suddenly the corticosteroids, the medications, because if the patient do so, then the Addisonian crisis will occur. That is, no cortisol production will occur then. Treatment depends on underlying cause. Like if the exogenous medications is the reason, the drug is gradually decreased. Sudden withdrawal will not be done because that will cause adrenal crisis. And if the reason being presence of tumor, that is the pituitary adenoma, then the tumor will removed. Surgical excision is done. And if patient is not comfortable with the medications and surgery, then radiation therapy is used.